There's a lot of conflicting information in the media about weight loss medicines right now. And if your goals include improved health and weight loss this year, we want you to know the facts. Hi, I'm Dr. Jared with JAG Medical Spa, here to answer questions about medical weight loss. At JAG, our weight loss program stands out through our dedicated focus on close monitoring and a collaborative approach to your success. We prioritize a comprehensive strategy where monitoring is not just a checkbox, but a guiding principle. Our focus on data involves regular check-ins, body scans to track results, personalized assessments, and continuous support, ensuring your progress is on track and tailored to your evolving needs. All right, our program includes an assessment with one of our medical providers. And then we really just talk about what your goals are for a weight loss program. Once we find out your goals, then part of the structure includes medicines and then really close monitoring, which is really important. We typically will see clients every 4 weeks to repeat a body scan to assess body composition, to see if we are achieving those goals. And we repeat this process until those goals are achieved. Now, there is a maintenance that we do as well, where we'll keep in contact and help support you through to make sure that you maintain your weight loss. So with lipotropic and B12 injections, these are really beneficial for those who are already on a really goal-oriented nutrition and activity plan, and they just need a little bit of a bump for their energy. This helps kind of achieve a little bit more of that weight loss, since most of these medicines are involved with metabolic processes like fat and sugar metabolism. As far as the GLP-1 agonists, those are the medicines that are been in the news and the media lately, and that involves the semaglutide and the tirzepatide, also known as Ozempic and Wegovy. Phentermine has been a medicine that's been used for a long time. It's a stimulant, and so essentially, we're not a big fan of this medicine because of the cardiac effects and other effects. It can make you feel very jittery. It can give you heart palpitations. We don't tend to like to use these medicines, but those who benefit from it is very short-term benefit for about a month or two. If they just need, once again, a little spark and they're not wanting to do a medicine long-term. So these medicines are very safe. Monitoring is very important, and I highly recommend not getting these medicines just on an online clinic. Make sure you're going to a clinic and seeing a medical provider. The reason is the side effects can be ranged from very mild to very severe, and we never really know who's going to have those severe side effects from these medicines. The mild side, most everyone experiences some form of acid reflux, maybe underlining a little queasiness. And then those side effects can potentially get more severe to having really bad vomiting, pancreatitis, and potentially gallstones. And the reasons for that is why we monitor so closely, is to avoid those complications. But otherwise, these are very safe medicines if used appropriately and used in the right clients or patients. For most of these medicines, you'll read that once you stop, that you will gain that weight back. However, we've had a lot more success with our program because of that monitoring, and because we actually see clients when they're off of these medicines as well, just making sure and checking in. Just like anything you do, diet, exercise, as soon as you stop those things, there is that risk to gain that weight back. And so a lot of it is making sure, and we always talk about this in terms of a nutritional plan that you can stick to, that you can stay with. And even if you go astray here or there, it's a plan that you can fall back on. And so our results are a little bit different than most clinics because of those reasons. We have a high success rate of not only losing that weight, but keeping that weight off. When we talk about weight loss with our clients, everyone falls in a different category. And so we have some clients who may not need to lose weight, but they may need to lose body fat percentage. And we treat these clients very differently than someone who just needs to lose weight. And so we tailor your goals, but we also do a body composition scan and discuss the healthiest goal for our clients so that so we can achieve just an overall wellness and health. So yeah, we want to make these medicines accessible. They are very effective, so prices will vary and always varies depending on the client and their goals and what medicines we use. We do have membership programs that can reduce the price. There's no initiation fee. It's a month-to-month membership, and you don't have to have the membership to start these medicines. It does just help, particularly if you're getting other services in our clinic. You have to be mentally prepared and physically prepared if you want to achieve your goals. And that's about trusting the process. We've had a lot of success, and sometimes it may not come at a fast enough pace, but we can get there in a healthy way. What we always emphasize is healthy weight loss as opposed to unhealthy weight loss. And so if you can come with an open mind, once again, we'll address not just weight loss, but other things, whether it be hormones or other treatments that may build that confidence. Once again, if you trust that process, you'll see at the very end how happy you'll be. So we definitely encourage, whether you go to JAG Medical or another clinic, that you are assessed by a medical provider. We want to make sure we check your medicines, any other potential health risks. As far as the chosen weight loss approach, this is something that we will get more information from you as far as your goals. We do a body scan to make sure that you're a good candidate for this weight loss medicine, and get more of a history as well. So at JAG Medical, we don't really use BMI. I think it's an outdated measurement. It's not very accurate of overall health. We go based off body composition. And I always recommend that if you're going to any weight loss clinic, that they go based on body composition and not necessarily BMI. So with body composition, the important thing to us is someone can have a normal BMI, but their body fat percentage is above optimal health. And even if you have a normal BMI, if your body fat is high, you still are a good candidate for weight loss. And so we approach it more based on body composition as opposed to BMI. We have a spectrum of clients who come in, all the way from the bodybuilder that really doesn't have much weight to lose. They might have just a little bit of body fat, versus the diabetic or obese patient that has more weight to lose, is on more medications. And so really it's that first introduction where we sit down and we go through your medical history, we go through what your goals are. Once again, get that body composition and see, what the best option is for you. So our goal for these medicines is not to keep you on it forever. And so once we wean these medicines off, we typically will schedule 2-month follow-ups just to keep you on track. Certainly you can come in earlier if you feel like you've fallen off or have struggled. Our goal is, once again, to kind of keep that guidance, keep that nutritional plan so that we don't necessarily have to go back on these medicines. I always tell clients, make sure you let us know if you put on a couple pounds. Please let us know beforehand, don't wait. And then that way we can catch it earlier on. So one of the big goals of our program is to develop what we call a nutritional plan. I don't like to call it a diet because diet's always something that you do temporarily, but a nutritional plan is key. We don't necessarily have a handout because everyone's nutritional needs and even their taste for foods are different. And everyone's schedule is different. So they may not be able to do much for the way of lunch or breakfast. And so we really tailor a nutritional plan past the medicine treatment. And this is something that, once again, after coming off these medicines, we're always available for discussions, repeat body composition, and just be available for support. We're pretty stern about making sure that you have to come to us to get these medicines. We want to make sure that we're following, our comfort zone. Our comfort zone is making sure that we're monitoring you appropriately, so you don't have those complications, so you don't wind up sick or even worse in the hospital or something along those lines. So we do make it a point that you have to see us in person to receive these medicines. Now you can, and what we do is we train you how to deliver the medicines so that you can take them home. And then each month you come back in, we give you those medicines to go home with. We do that for a lot of reasons, to make sure you're taking the medicines correctly, make sure that you're getting the appropriate dose. Once again, we're focusing on overall body wellness, which includes healthy weight, but then also doing other treatments to benefit skin, to help build that confidence in both your youthful appearance. And so we highly recommend kind of combining different services. Of course, as you go through weight loss, we all talk about those changes that occur, and we have other treatments that can help tighten skin, body sculpting, different things. Once again, nutritional services and things that go together. We had mentioned previously our JAG Medical memberships, and this definitely helps if you're looking at adding different services. It gives you a little bit more of a discount.